Yes, as I was explaining to you that military personnel, they have a proximity to Pembroke Hospital for MRI part, but that is only the clinician when they want a better diagnostic about what part of the body is not working well, and they can diagnose that. But what they cannot do, like any other clinical MRI in the town and in Canada, we are the first in Canada that we are dedicated only for research and mental health as well as a particular focus. Although we have the capability of doing more than just mental health research, but our focus is on mental health. And that is what we are doing here. Basically, when we have a study as a research going, how do we recruit our people, our patients, or our subjects for the study is through the physician who is dealing with the personnel that has mental illness. We recruit them, and then the researcher at the moment, what they do when they want to treat them or cure them is just by interview, behavioral symptoms, and based on all those experience years along, they provide the drug that they need to. But they don't have biomarker. They want exactly to know the drug that they are giving to the patient, is it exactly doing what they want to do? And also, what is happening in the brain? What type of chemical is not doing right? What is the amount, excessive amount or lack of the amount? All of those things is what they wanted to see. With the scanner we have here, we can measure all those sort of chemicals in the brain. There are a scanner, and they have been studying a lot about the different chemical of any different part of the body, of the brain also. But this scanner especially, we have the extra hardware and software for multi-nuclear detection. So we can basically detect more chemical properties than any other scanner, and this is two components on each other, on the top of each other. When you do MRI, you basically take a picture of the tissue inside the body, in this case brain, and they can slice it very fine, and they can actually see every tissue. But when we are talking about mental health, it's not that we are looking at a tumor or some object or that is big enough that we can visually see it and then go take it out, do the surgery, do the chemotherapy, do all the treatment. What we are actually looking in the mental health is at the cellular, molecular level, what is this neurotransmitter are doing? What sort of chemical they are back and forth communicating? And of course, those gives us the behavior that we have, the action that we do, the emotion that we feel. These are all what we are going to measure right here on this scanner. And there is two parts of research which is coming together to lift the research to a higher level. We can, with multinuclear detection, we can actually component of the chemical in any part of the body of the brain, we can measure it. The functional MRI has been around for many years. They give you some task in the machine, your brain starts to activate based on what you're doing or what you're feeling. I can show you some pictures and you feel happy or sad or angry. That brain at that part is activated, and they can measure it just by MRI. But in this scanner, I have another big component of research coming hand to hand with this fMRI, and that is the nuclear medicine part of this scanner. I can inject the patient with the tracer, isotope tracer, that goes right in the bloodstream and goes around like a surveillance, goes through the body and gets trapped anywhere that the cellular and the molecules are doing something that they're not supposed to do. It's not healthy to do that. So they basically, that is big, huge part of the other field of research, which we call it nuclear medicine. How the researcher comes to the point that which tracer to send as a GPS, basically go through your body and get those cellular that they're not visible in MRI because they're not showing any like big size tumor or anything, but they're actually doing something that they're not supposed to do. So this tracer goes there, get trapped, and this machine, I put the brain there and I detect, get more pictures, but this picture is kind of, all it tells me is all those points that this tracer got trapped in a very understandable and comprehensible way at a researcher or a nuclear medicine physician can see it. But if you ask that, okay, where is exactly in the brain that this is happening, I need an anatomical picture. I need to match these two pictures on top and say, yeah, exactly, I know which depth, at which volume, at which cellular tissue level this is happening. So basically detect what is happening in the molecular, also put MRI on top of it to detect where is it. And this machine is not only can do it for brain, it can do it for anywhere. If I have a personnel or a subject study that has a problem in heart and it's not easy for MRI to be visible, all those things that happening in the heart, in the lung, abdomen, pelvis, leg, basically top of the head to the toe, everywhere. I can push the patient, focus on the part of the body that they are interested to investigate, and I can provide them what is happening at the cellular level and where is it exactly by matching these two. So what I'm trying to say here is, of course, we have MRI, very advanced field in medical imaging. We have nuclear medicine, very advanced field in the medical imaging. But these were not married together until we had the technology to be able to put these two inside one casket, and they are not being interfering with each other to bring distortion. Previously, we knew that this is the best idea to put this together because then I can take the picture exact the same position, but the technology was not there. Now with the solid state technology improvement and all the other, they could bring these two different medical modality imaging to be in one casket, and that is where we are lucky enough to have this scanner to be able to do that. Previously, there was lots of study, and that is how the research evolves, because you won't stop. If you don't have enough instrument equipment, you wish for someday to arrive, but you do not stop. So you start. The nuclear medicine did his job, MRI did his job. I get the subject, I put it in a machine in MRI, take the subject out, put it in nuclear medicine. Yes, of course, I have two pictures, but I just only have to hope I did my best that these two pictures are exactly matched. Here, there's no doubt. It is exactly matched. So now all those research behind it, it can come here. First of all, no problem, no doubt. This is what, and that is now we get like I feel that somebody brought the flag to me, and now we can carry on forward. So more research and more things to be done. And luckily, we have 5 years only research facility and focus on mental health. Cannot be better than that. And nationally, we have a user group, all the researchers coming together. There are already lots of interest and a study being forwarded, and we are open yesterday, we are ready to go, and we already started.
And so what this will allow you to do when it comes to like an OSI or PTS or an OSI,
Yes.
which is a mental health issue,
Yes.
you would then put the subject or the patient
Yes.
into the machine.
Yes.
It would read how their brain is functioning.
Yes.
Which then gives you an idea of what is working for treatment, what isn't working for treatment,
Absolutely.
or what maybe try a different way if nothing is working. Is that what this machine?
This is the start point. I provide the subject,
Yeah.
the research study. In this research study, it says what is the purpose of it,
Yeah.
what is the goal and vision, why we are doing that, and then the physician who have the pool of patient who has those symptoms that the researcher want to investigate, they provide those people to us. So imagine one person arrives, and we are all licensed to be clinically deal with the patient.
Yeah.
And also I am licensed as a researcher, as a medical physicist, to know exactly what type of picture to be taken.
Yeah.
Because it's not only all of them one simple picture. There are so much physics and so much of different research behind it, what sort of software and hardware we need to get that evidence, which
Yeah.
is that picture, that particular picture. And also this research area, I'm sorry, somebody is in the magnet room. I have to make sure they are protected.
Yeah.
As a safety is first.
Yes.
Some. Robert, are you here? I wanted to make sure. Sorry, it's just that I wanted to make
Oh,
sure.
yeah, no, because I wanted to make sure, because I said everybody else didn't see him.
I'm sorry, I stopped the.
Oh,
yeah,
did
yeah,
you?
yeah, it's okay.
Yeah.
As long as some
Yeah,
one
it
of
was
us, because it's the safety.
No, absolutely.
Yes.
Good.
Sorry about that.
That's okay.
Yes.
No.
Yeah. Yes. So we get the picture, and it's not only this equipment. We have so much more equipment to be able to like stimulate brain
Yeah.
for the level that they want, for the task that they want. So we have more equipment aligned with this big scanner to make that happen. There are, like, at the same time we can measure the EEG of the brain, everything. And then yes, of course, we get that evidence. What happens after that? Lots of data processing, lots of computation, and we have in this facility, that is the very big point, because now you have data, how you analyze it,
Yeah.
how you get the result out of it. That is where our visualization data lab, which lots of computational equipment, they get that there. And then when the result is out, provided to the physician and the researcher, they can understand, well, okay, now we know that these are the chemicals. Oh, this is the amount, that it shouldn't be that much or this much. And then they go for the drug to prescribe. And if this drug is not working well, or if works well, how do we know? Follow up. The same person, after having that treatment, comes and get again the same process. They can always bring it to a balance to understand that everyone can get a personalized type of treatment. That is what we are going for.
So this
And
is
evidence-based.
And this is the beginning. This is the beginning of that. You're embarking on that journey as you start the research
Yes.
with the machine
Absolutely.
to see where hopefully
Yes.
get some results.
Yes.
And within
And-
5 years
And you know, research, you can't, the timeline for research,
Yeah.
you always hope for the best. You get lucky and you have a huge result tomorrow, wonderful. You know, but the point is, we do not stop.
Yeah.
We always dig in. I myself, I am in a research area like close to 30 years. I started from being a student in a research lab. I am working hard to know more, because it's unlimited. And when it comes to mental health, that complex brain that is here is even more. And the awareness these days about mental health be able us to have all this facility, and we're hoping that that is the best avenue to be in, and we will successfully go ahead.
Perfect.